just had a couple of questions that I'll get the answers for you. I was asked if the presentations today are going to be posted online, and they will. They will be posted on the website. That will take just a few weeks to get that organized, and some of the presenters may need to remove a couple of slides here and there. But we will get those on the website. We will get those posted for you, and look for those toward the end of this month. The other, again, just for clarity, your breakout group number is on your badge. Groups 1 through 7 are down the hall past the registration desk, and breakout group 8 is here in this room in the back corner. Well, we are ready. Thank you. Again, thanks to all of our panelists for superb presentations. Would anyone like to come up, and we'll give precedence to anyone that wants to ask a question in person. Other than that, we'll go to the cards. Anybody want to come to the microphone? If not, we will start. And thank you for filling out these cards. The first question is for either Dr. Shryock or Dr. Apley or both. The Presidential Advisory Commission was mentioned. Can you tell us a little bit about what that is and what the goals are?
As you know, the Combating Antibiotic-Resistant Bacteria National Action Plan was released earlier this year. As part of the executive order that created the strategy and the action plan mandate, there was also an opportunity for a federal advisory committee to provide oversight and review, make recommendations at some point as to the 5 goals that were listed here during my talk. The idea is that the Presidential Advisory Council, which numbers 30, there's 15 voting members, 5 liaisons, and 15 representatives from federal agencies. That group will be taking charge of really evaluating the programs that have been proposed by the various agencies and making a review, basically, as we go forward here in 2016. There's already some meetings that are on the agenda, and our goal basically is to make sure that the proposed plans can be carried forward into the right ones, and that the goals will be achieved. Mike, do you have any further comment?
Yeah, so we had our first public meeting in September, September 31st, right? The first part of that week, right around in there. And that meeting was to have multiple agencies came to us and talked about things they're doing. And then we have another public meeting scheduled for March, and then another one for, I believe, the next September. June? Is it June? Okay, so we're really on a fast schedule. As a matter of fact, tomorrow I'm going to step out late morning, and our working group is having its first conference call. And both Tom and I and all the other members of the advisory council are on 2 of the 5 working groups. And Tom's co-chairing one, I'm co-chairing another. And we're starting out evaluating what's out there right now. And that's going to be our first step, and I think that's what we're going to come with reports to the second public meeting in March. And then we'll keep evolving in what we're doing along those 5 major goals, and a lot of really incredible people on that council from a lot of different worldviews, a lot of different expertise backgrounds, and I'm just really looking forward to the experience of it.
I'd just like to add one more thing, and you're seeing 2 of the members here, but remember that there's probably more members that are representing the human health side of the sectors involved in the animal health side, and so a lot of the activities around the CARB and so forth are really concentrated on the human health side, but of course there is the important aspect of the animal care side of the equation that is included in that, and so I just wanted to make sure people were aware that it wasn't just agricultural animal use.
Yep. Next question is for Dr. Tokes and or Dr. Braden. With more and more producers using or producing antibiotic-free meat, going to an antibiotic-free production, do you expect the possibility of having more foodborne illness?
Right. The concern, I guess, is that if antibiotic use is in some way reducing the prevalence of contamination, would eliminating that as a tool lead to more contamination of the food that results. I think that's something that's been raised. I've heard it as a concern for some years. I don't think I've seen evidence that it happens. There is a whole difference in production often that goes along with it, the quote organic style of production. And I don't have reason to think that animals that are raised under organic conditions should be expected to be any less contaminated than animals raised under conventional conditions. I don't see why that would be. I don't think it's really an issue. Organic production isn't focused on microbial targets. So I don't know of evidence that must happen. I think it's something to be alert for. And as I think Dr. Apley noted, that a major part of stewardship, a major part of this is reducing the risk of transmission of the pathogens themselves, as well as of the resistance. And we need to do all of the above.
Anybody else want to respond? Okay. The next question is for Dr. Apley. Is it possible, in your opinion, to develop a specific set of stewardship principles or guidelines, as Dr. Tokes presented for human stewardship? And if so, what principles should be included in that?
It's a great question, and one of the things Dr. Tokes mentioned in his was emphasizing that some of those were hospital-based, where you really have control. In veterinary medicine, we have components that would be very similar to the community practice in human medicine that are widespread, smaller groups or individual practitioners who would have a completely different relationship with a set of guidelines and feedback capabilities than someone working in a large veterinary practice, which may be more similar to a hospital. In those hospital settings, they have the ability to have a committee that says, okay, before you put someone on meropenem, you have to get approval first. If you put them on pip-tazo, you get reviewed in 48 hours and may have to de-escalate. You can set those kinds of rules where we'd have a little bit more of a challenge on that. There are multiple organizations which have put out what are essentially stewardship practices. The bovine practitioners have just recently released a guideline on judicious use and principles we should follow. The challenge is trying to produce medicine in a box where we can reach out and give guidelines that say, if you see this, you shall do this, or else you're guilty of not following the guidelines. And as a clinical pharmacologist who has practiced after becoming a pharmacologist in a production medicine setting, our practice took care of 1.5 million head of cattle a year in feedlots. I was alerted to the fact that despite my PhD in boards, not everyone got better. And despite some very convincing papers that the bacteria should have succumbed to my brilliant treatment plans. And it brought me a little humility in the concept that I could prescribe a certain set of standards. So yes, there are standards, and our organizations have put them out there. If you look at quality assurance programs aimed at producers, if you look at education initiatives by swine veterinarians, the American Association of Swine Veterinarians, American Association of Bovine Practitioners, Academy of Veterinary Consultants, they're out there, but to actually come down to this antibiotic first, this antibiotic second, or those types of things, it's harder.
Okay. For Dr. Shryock. Dr. Shryock, what do you think are the biggest differences in the landscape of antibiotics in agriculture since that first meeting just 4 years ago?
That's a very good and challenging question. I think it really depends on one's perspective. So there'll probably be a lot of different viewpoints even in this room. From the question being directed to me, the things that have changed immeasurably is the adoption of the VFD, the Guidance 209-213. There's been a tremendous amount of support from the animal health industry, from the practitioner side, and now moving into the producer areas. So that's been a real key thing. It's really been moved forward. I think some of the other pieces that also have changed are just the overall awareness of the antimicrobial resistance issue, and focus in on some of the questions around pipeline. What's in the human drug pipeline? What's in the veterinary pipeline? Looking at alternatives, there's this whole piece around innovation. Can we find products that will treat, control, or prevent disease in a different way? So I have a sense that there's a hunger for those kind of products, and folks are struggling, whether in companies of all sorts and sizes, to really go down that route. So that will replace it, but it does then come back to the question that Mike was asked around stewardship. We've got to have that in place, and groups are working on that, because even if you get new drugs or products, you still have to use them in the proper way at the right time. So you kind of couple all these things together, and I have a sense that from the prevention, from the diagnostics, from the treatment, and then the follow-up, the post-mortem on records, as Mike had called it, that cycle must continue. So I see progress moving forward, but it might be a little bit slower than some folks would like to see. But those are the changes that I see really in the last 4 years, and I'd like to think that the NIAA meetings have gone in some measure toward achieving those goals.
Please.
Steve, I just wanted to add one more thing, and changes I've seen in the last years. As never before, I'm having interactions with private veterinary practices that have asked me to come in and review their uses or ask me to have input on a stewardship program. Just last week, I got an email from a young veterinarian who has been challenged at the next practice meeting to take 3 drugs they use for one indication and come up with how they best decide which one, when to use it, the regimens, and of course they're focused on avoiding having to use them. But I'm getting questions like that from practices that are in a much higher frequency than I have in the past.
Well, I'll take the liberty of saying that the discussions around antibiotic resistance that I've had the fortune to be part of or to hear about, I think have become more rooted in reality in the last 5 years, and at least for major parts of the dialogue, we have multidisciplinary approaches, multidisciplinary groups, meetings such as this one, beginning to talk about the fundamental and real issues and real solutions, and I think that's been a tremendous step forward.
I'm going to take it in a little bit different direction with a comment about what we're seeing on the human health side as far as the use of antibiotics and some of the things that I think we can look forward to. And I think if people have been paying much attention to the dialogue around the microbiome, we're seeing a lot of attention being paid to what is a healthy microbiome, what is a disrupted microbiome, and how does that affect our health. And I think we're going to be, there's a very interesting hypotheses out there about how disrupting a microbiome can affect human health. Certainly the most direct one is that we've been talking about a lot is the risk that people will will undergo with a disrupted microbiome from, for example, from taking antibiotics to the illness from Clostridium difficile. But there are other types of even chronic illnesses out there, and it's a lot of the conversation is around disruption of the microbiome by the use of antibiotics. And so what we're seeing is an expansion of the discussion around the use of antibiotics, certainly including the development of antimicrobial resistance, but also other types of potentially adverse health effects of taking antibiotics beyond a generation of antimicrobial resistance.
This is question actually I think is related to what you're just talking about, Chris, but maybe a little bit different. Either you or Rob can expand on it. Agriculture is beginning to experience real change. The elimination of growth promotion labels, the implementation of the veterinary feed directive, all coming from a regulatory and government oversight perspective. Are there any real changes in terms of regulation or government oversight coming on the human health side of the equation?
Well, Marion and I were just discussing of the fact that there's a very powerful lever that's been already pulled, should I say, in the human medicine arena, having to do with reporting hospital-acquired infections and antibiotic resistant infections and so forth, when the Center for Medicare and Medicaid Services said that they would require that reporting in order to be in order to participate in the Medicare program. So that's a huge financial incentive in order for hospitals to report. And not only do they report, but they report by name. So it's not anonymous, and it's published. And so that, I think, is a regulatory policy decision that has made probably a big difference, and all of us can take advantage of that by going to websites to see, well, what kind of infections are seen in this hospital. What's the rate of the infections? Is that what one would expect, or is it more than one would expect? That's information from all of us. So certainly there are those types of policy and regulatory decisions on the human side that's occurred. I think there probably will be more having to do with certification of hospitals by the Joint Commission and so forth, which is a hospital regulatory body that would require one to have an adequate stewardship program in order to operate as a hospital, as an accredited provider. So yes, there are some fairly heavy levers out there that are being pulled in order to really make stewardship much more, mandatory in a way in order to practice medicine.
Okay. This is a question for Dr. Apley. We mentioned just 2 minutes ago the veterinary feed directive. The question is, are current veterinarians and veterinarians that you're training, are they going to be adequately prepared to fulfill the requirements of the VFD?
There's two parts to the answer to that. One is just sheer capacity to handle that, because if you look at kilograms sold 2013, you're talking around 98% of the kilograms sold that will be coming under with the food animal label, with all the imperfections of the numbers, but it's what we've got to work with. About 98% of those will now come under veterinary control as a veterinary feed directive for in-feed use or prescription for water use. And we are working with partners that will hopefully be providing electronic formats. We're talking with producers about the necessity of the veterinary client-patient relationship to be able to fulfill those VFDs. We're working on finding out, or for the veterinarian to be able to give them a VFD, we're finding out about where people will and won't be able to obtain those drugs. And the veterinarians are working very hard to make sure they're ramped up as to the decision points, and it goes down along those lines I talked about. Stewardship: is this really necessary? Does it give us a benefit? We don't want to do something because it's routine, and that's why veterinarians are being put in that place. So the veterinarians are very cognizant of that responsibility, and they're well trained in pharmacology. We also are, if you look at the meetings that are coming up this next year, again, the swine veterinarians, AVC, poultry veterinarians, bovine practitioners, going to be a lot of focus on that as well as other CEs. So it's a transition to an increased responsibility for additional classes of antibiotics, and we'll be working hard to expand our ability to handle that.
Thank you. Next question is for Dr. Tokes. You mentioned that resistance in Salmonella overall is going down, although not in all the serotypes. Are we already winning the combat against antibiotic-resistant bacteria?
Yes. Well, I think we have made, there has been some important progress. It's a little hard to know exactly what contributed to that progress. If we were meeting here 15 years ago, we would be talking about some impressively resistant strains of Salmonella typhimurium that went by a British designation, subtype DT104. We would be talking about multi-drug resistant Newport, which burst on the scene in the late 90s, and then in the bovine sector and rapidly accelerated and has been declining since. Now, those were the specific issues, and they have diminished a lot, and the collective problem of multi-drug resistance has diminished a lot. Now, perhaps there's folks who'd like to take credit for that diminishment. I think a lot of disease control efforts on farms were part of that reduction, as well as attention to which animals were slaughtered where. So I think we have made progress. There are these new serotype combinations, resistant serotype combinations that are rapidly emerging as a problem, and I think they need. The lesson to me is that when we find and identify and focus on those specific resistant issues, they, with attention, they can be controlled.
Okay. Again, this is a follow-up. I think some of this has been talked about, but the more specific question is, financial incentives were mentioned regarding changes in human health prescribing and use of antibiotics. Shouldn't agriculture be given financial incentives rather than just having to carry the regulatory burden and the additional cost of regulations? For example, ag has to pay for the VFD. Either.
Yeah, well, that's a non-controversial topic. We'll just roll right into that. The whole issue of who drives costs, agriculture's become pretty familiar with unfunded mandates. And so there's three things that affect this: regulation, legislation, and what I call retailation. Right? With the effect of retailers feeding back through packers, and we want more transparency, and we want of what's going on, and so is it a premium to provide this, or the lack of a detriment because you now have access to a market chain that you may not have had if you aren't doing certain things or providing certain records, and it gets really hard to decide. I've become pretty convinced in the beef industry there's no real premiums, just avoidance of detractions in value. So the whole issue of where dollars, I'm stammering around because the whole issue of where dollars come from to pay these things and what drives things are very, very, very complicated. And an incentive out there would be nice, but the thing that's really important to understand about agriculture is the people that are in business today have made the best use and are now making the best and most efficient use of multiple inputs in a very complicated combination. That's land, water, animals, fuel, labor, and technology that allows them to manage disease and prevent disease. So somewhere that all fits in there, I guess.
Thank you. Anybody else want to comment?
Yeah, I think that there have been some successful voluntary industry-led disease control programs of dealing with human diseases from animal sources. And somewhere in there are financial incentives, I suppose. Great Britain brought Salmonella enteritidis down dramatically by focusing on both their poultry and egg-laying flocks with a whole package deal of disease control, of contamination control and vaccination of the flocks. And they marketed it as the British lion, and every egg produced under those conditions was stamped with a little red British lion. And then people were told, you know, if you want to buy good, safe British eggs, look for the British lion, not those whatever imported eggs that there might be on the market. And salmonella dropped by over 80% in Great Britain. These are sort of, there was a defined package of interventions around a food commodity that was visible to the consumer. And the consumer had a reason why they would want to look for that. A number of Salmonella enteritidis in egg control measures in this country were based around the 5-star plan that the egg industry came up with. And I think that an industry group that organizes, here's what we're going to do, these are the things we're going to be doing, here's why they're good, and here's how you can tell if you're getting product that was produced under these conditions, can make it a market success.
There's one example in the U.S., the process verified program for poultry, raised with responsible use of antibiotics. That's so it's PVP and it's verified by the USDA with them inspecting. So there's one there where they've come together with here's the veterinary involvement. Obviously no use for growth promotion. If they have prevention that's more than a couple turns, I think, then they have to have their veterinarian talk with the people. So there's some that are being put into certain market channels like that in the U.S. also. Yeah.
I'll just say on the human health side, there may be some instances of pilot programs and so forth that have some funding that might go with it to increase their Medicare payments or something, but in the most part, I think it is the avoidance of decreases in funding that is really driving a lot of this. But there's also some data that is coming out that would indicate that if you do, prevent these types of infections that are resistant to antimicrobials, that you will actually save money because those patients don't stay in the hospital as long, they don't take as they don't come back as often and so forth. So it's a little bit different realizing in the animal care side that some of these types of organisms that we're talking about are not actually making the animals sick, but in some cases they are. And so if we're talking about the Dublin, for instance, that's making the Salmonella Dublin that's making the dairy calves very ill, then there may be the financial benefit of addressing that in a stewardship way that they would be able to save those calves in the future. So there's that aspect to it too, is looking at the economics of preventing those types of infections down the for the individual patients or as part of the industry.
Thank you. Last question, and then we're just out of time. For Dr. Tokes, in relation to salmonella resistance in the food supply, has there been any consideration for development of multi-drug resistant bacteria in honeybees?
Are there multi-drug resistant pathogens in honeybees? I don't know very much about the use of antibiotics in honeybees. I think of honey itself as being pretty antibacterial. So that's an interesting question, and I'd be glad to talk with whoever it was that asked it to learn more about what I have no idea of.
So more to pursue. So we're going to do a quick changeover. Thanks to all of you for your questions and to the panel for their answers.